Well, if you ever find yourself chewing ice uncontrollably or you have some jaw pain that just won't seem to go away, it might be your body actually telling you something that could be a little more serious.
All right, here with 5 surprising signs of illnesses that your body may be signaling is internist Dr. Keri Peterson. Dr. Peterson, good to see you.
Good morning.
Happy New Year.
Happy New Year.
And before we dig into these symptoms, we want to say that if you've experienced any of them, check with your doctor before you do anything. And the first one, this is one that surprises me. A symptom most people wouldn't think is the sign of a heart attack, and that's jaw pain.
That's correct. It is a symptom that occurs on the left side of the jaw. It's mild and it's dull, and it only lasts a few minutes, and it's caused by the nerves being agitated around the heart when the heart is losing blood supply. It irritates those nerves that sends a message up to that area of the body. So, and it's more common in women actually than men, which may be surprising. Women should keep that in mind.
All right. Not all jaw pain, though, is related to heart attack.
Right. Just because you have jaw pain, you don't need to go running to your doctor. If it's happening when you're chewing, then it's very unlikely to be related to your heart. But if it's happening when you're exercising, then see a doctor right away.
Okay. And next, this is an interesting one, yellow bumps on the eyelids. What does that signal?
That signals most likely high cholesterol. It is fat deposits that happen on the inner eyelids and around the bottom of the eyes as well. And a simple blood test can diagnose that.
And not to be flipper about it, but does this matter whether you're black, white, Asian?
It can happen in any skin type, but it can happen hereditarily in Asians where it's unrelated to high cholesterol. For other skin types, it's usually due to high cholesterol. And when you treat the high cholesterol, it doesn't always go away. You may need additional therapies like surgery or laser to get rid of them.
To get rid of the bumps.
Yeah.
Okay. If you're really thirsty, coupled with frequent urination, it could be a sign of diabetes. I think a lot of people have heard about this, right?
Yeah, I hope people have heard about this because many of my patients think that craving sugar is a symptom of diabetes, but instead, frequent urination and thirst is a sign. And the reason this happens is when you have high blood sugar, it leaks into the kidneys and is excreted in the urine. The urine gets concentrated and osmotically pulls water out of the body, causing more water into the urine, so you urinate more frequently, and then that loss of water in the body causes you to be dehydrated and you're thirsty more often as well.
But if you're thirsty and you drink a lot of water and you go to the bathroom a lot, doesn't necessarily mean you have diabetes.
It can be confusing because there are other things that can cause thirst, just dehydration from exercise, for example. But if it's more excessive and you're very thirsty frequently when you don't expect to be, you should get tested for diabetes.
All right. This one is very interesting. Chewing ice. If you're somebody who can't stop chewing ice, what could that be?
This is a good one. This is iron deficiency anemia. And I've seen people in the supermarket chomping on ice, and I want to stop them and say, get your iron checked, because it's quite common. It's called pica. It's due to iron deficiency. It's more common in women simply because women are more likely to get iron deficiency because of lack of iron in the diet or from heavy periods.
Why ice, though?
It's not an understood phenomenon. We don't know why. It's very strange.
Okay, and lastly with this last one, blistering rash on one side of your body could signal shingles.
That's correct. Shingles, which is a reactivation of the chickenpox, causes a blistering rash in a band, usually around the torso or on one side of the face. It doesn't cross the midline. And it can be treated, doesn't cure it, but with antiviral medication you can shorten the duration and the severity of the illness.
All right, again, check with your doctor if you have any of these symptoms.
Yes.
And if you think it may be something more serious. Dr. Keri Peterson, thanks so much.
Thank you.